Hello, and welcome to our podcast for the Cross-Cultural Skills course from the SSW program at Humber College. I am Nicole Diaz.
I'm Samantha.
And I'm Shidani.
Good, welcome girls. In this podcast, we're going to be discussing a social issue that we found in an article of Ontario's failure to provide healthcare to all is a moral failure as well, by Hannah Stell. In this article, Hannah critiques the Ontario's government decision to end the physician and hospital service for uninsured patients. This program, known as well as the PHSUP, was subsidizing medical care for individuals who were not covered by OHIP, the Ontario's health insurance plan. Most of these patients were new permanent residents, international students, temporary foreign workers, or undocumented immigrants. This action forced the community health centers to fill in the gaps, but none of these resources were enough to support and provide the services for all these people. As a consequence, these leave patients outside of the healthcare system and not being to get all the medical care and attention that they needed when they needed it.
So the main human rights issue that we found with this article is that they took away healthcare access to residents without OHIP or an insurance plan. It was a temporary program, but it left a lot of people, especially marginalized and vulnerable populations, such as the populations that Nicole mentioned earlier. And this makes it inequitable because by destroying or removing the program that allows them to access these healthcare resources, they'll be left at a very vulnerable state, and they'll be left to go to the community healthcare centers that were meant to replace this program. However, it's a problem as well because the community healthcare programs are operating at full capacity, so they don't even have a space for these new clients. They'll have to keep hopping. Like we read in the article, somebody had a open leg injury, and by the time he got around to their agency, he was no longer eligible for whatever healthcare service he needed.
Yeah.
Also, she explained in the article that she was not trained to tell people that there is a cost or charges or a fee for those things. So she was like really sad, or because she needed to tell all of these people that there is a cost of these procedures, and also like to have all of this on her. I think it was a really bad
That's
thing.
honestly an issue with this as well. Another health or human rights issue that I found is that Canada's healthcare system, they like to advocate that health is a right, not a commodity. And for anyone who doesn't know what a commodity is, it's something that you can buy or sell. So Canada's basically saying that healthcare, access to healthcare, shouldn't have a cost. But guess what? It does, especially even more so for uninsured patients, and it's not fair for them.
Yeah, especially for international students, like for example me and Nicole, that we were here before and we didn't have OHIP or anything like that before, like we start studying. I think that, I don't know, for example, for me one time I get injured in my arm and I didn't have anything, so I went to the emergency, right? So to hear the amount of money that I needed to pay to like fix my arm was like, you know what, no, I can handle this, and I keep it for a month like this without moving my arm, so I can imagine other people like suffering like injuries, like more
severe injuries, yes.
like me, like, oh my God.
And it's not just injuries. We're talking about pregnant women
Yes.
who cannot give a safe birth.
There's also like language barriers into getting the health, like into the
Right.
healthcare system. I remember we were seeing a map of diabetes and hypertension in another class, and like the Jane and Finch area was one of the most predominant areas that had these diseases. And if we see it, like most of the population in the Jane and Finch area are mostly Latin American communities. And like if we in our countries we suffer from those healthcare issues, and then we come here and there's no no access to healthcare, and there's like super expensive to get the healthcare that we need, like obviously there's going to be more and more and more of that issue.
Right. So what was the emotional response to the removal of this program?
I think Hannah was saying that. What were you also saying? Like it was like very emotional, depleting to stay, like to tell people that they cannot access. And I think we were talking about like there's all these services, but people cannot access. I remember
Right.
in COVID, like the vaccines, like you could not access to the vaccines because you didn't have OHIP.
Right.
Yeah.
Makes no sense. Like
And if anybody remembers, in Canada, you needed to have a health card to even get into majority of buildings, to even be like, to tell people you are safe, that they can access your records and be like, you have your vaccines. And imagine the amount of mothers who had to identify themselves but couldn't identify themselves or provide for their children.
But like returning on the COVID situation, what you said, it was like a privilege to have the vaccines, like all of these like people that have OHIP, it was like, oh, she or her or him have the privilege to get the vaccine because of this and this. And like the people, like, I don't know, refugees or something like that, they didn't have this privilege of the OHIP, and they weren't able to get the vaccine or anything else, like to see a doctor, or like if you were sick or something like that. And it was really difficult for them, and still, right?
It still is, yeah.
what do you think would be one of like social service skill that we could benefit to this population in a meaningful or practical way? Like what is something that we can bring as social workers?
Advocacy and empathy together.
Yeah.
Because advocating for that program to come back will help so many people, so many families, so many international students, so many immigrants. It just needs to come back. And not only just advocating for the program to come back, but advocating for more awareness about the fact that uninsured patients don't have access to this, or like just a mutual understanding of the system.
Also, I think like a deeper knowledge of our resources. There are places where they can offer you a medical care without your OHIP, and then it could be like free of charge. Like having a deeper knowledge of all the resources that exist.
Right. With all this information that we already have, that you said, we can just provide all the information to the doctors or the nurses. And if they can't help people, at least we can like advocate and tell them like where are the resources that they are free for them, or something like that, and try to like guide them to all of these resources that we already have in Canada.
For our listeners, how does ending this program show our society's values about universal healthcare? And what does this mean for our responsibility to help vulnerable people?
I think it shows how contradictory Canada is.
Yes.
Like it just like shows itself as like very like multicultural, and like also very inclusive, but like the real values and the policies where the values are, they're not implemented yet, and then there's so much work to do.
And then there's just also the ignorance, like not just from like the government, but from people who are like, oh well, it's not happening to me, so I don't really care about it.
Yeah.
It doesn't. It's not happening to me, and it's not. Doesn't just pertain to like uninsured patients' resources. It's just like if I don't have if I have access to it and you don't, that's not really my problem.
Empathy.
Yeah, it's more of a political than moral mindset. And but what this means for our responsibility to help people is that we need to focus on having control of not just the quality of the care that we're receiving. This pertains mostly to the professionals, but responsibility of the quality of care that they're giving, to also the cost of care. So it's not just the federal government that has access to like fund this resource. Like they should go hand in hand.
Yeah.
Canada has the resources, but it just chooses not to help.
Yes.
Yes.
And choosing not to, it's also a decision.
Yes, exactly.
It's political.
Yeah.
No, and
They're not thinking for the people. They're thinking for the money.
I think there is a lot of information in our hands. We're just not sharing it.
Yeah.
And we're just keeping it for like
And that's
ourselves.
what I mean by ignorance.
Yes,
you know?
exactly. And if you have the opportunity to like share the information that you have with someone, just do it.
Yeah.
Yep.
Well, thank you.
Thank you so much.
Ciao, ciao.
Bye.